Hello and welcome to Cancer Now with your freelance journalist Benedict Steininger. In our last episode, we spoke about cancer occurring in kids, giving parents useful tips on how to ensure the best outcome for their kids and what family members have to keep in mind. This week, however, we will talk about complementary treatment options, their advantages as well as disadvantages, or the impact that they have on the human body. With me is, as always, Cancer Now's cancer expert, Professor Dr. Alexander Herzog. Hello.
Yes, hello, Mr. Steininger.
A well-established oncologist around the world, and now we should go right to the first question, which is, why are complementary treatments so important?
First, we have to distinguish between the complementary treatments and alternative treatments. Complementary treatments means that you do treatments in addition to conventional treatments or traditional treatments. Alternative treatments means that you do treatments instead of these conventional treatments. The goal of complementary treatments is to support the body, support the immune system, and so in a different way to work against the cancer. The traditional or the conventional treatments in general try to attack the cancer by surgery, by chemotherapy, by radiation, or by other treatments. And unfortunately, all these treatments have a quite significant side effect on the body. In general, they weaken the body. They have side effects reducing quality of life. They may even damage the immune system and cause infections or other problems to come up in addition. The goal of complementary treatments is different. Here we try to strengthen the body, to strengthen the immune system, and also to help the body detoxify after chemotherapies or other toxic treatments.
So you've been doing this for quite a number of years. What is your expertise on it?
And I learned the necessity of complementary treatments at the University Hospital of Heidelberg, where I, for a long time in my specialization, saw how much patients suffered from conventional treatments. So we did first experiments on the interferon treatment in kidney cancer, and I saw patients really shaking so that we had to fix them in the beds. I saw heaviest side effects of chemotherapy. And at that time, and this is now more than 30 years ago, I decided, that's not the way to treat cancer. We need also treatments to help the patient get through these harsh treatments in a better way. And this was the point when I started with complementary treatments, and when also in general, I have to say, the research about complementary treatments started.
So we are basically talking about 3 decades of complementary treatment then.
Yes.
How strongly have those kind of therapies changed over the amount of years, and how much better did they become?
And the first time, if I remember 30 years or 40 years ago, in the first time it was like that some people gave complementary treatments, like for example mistletoe extracts, because of an empiric situation they had heard about, and some people had good experiences, but there was nearly zero research. Nowadays this has changed a lot. Most all of the actual complementary treatments have been researched very well in studies, and it has been shown that they are not damaging cancer cells, which was in the beginning often hoped for, but the studies showed that these treatments help quite well to re-establish the quality of life of patients, to reduce side effects of chemotherapy or radiation, and to make patients just faster fit after chemotherapy, for example.
So to dive a little bit more into complementary therapies, the biggest or most well-known one is probably by far local or in general hypothermia. So what other kinds of complementary therapies are there?
First, hypothermia is a very special type of complementary treatment, because this is also researched in the conventional system of medicine, because it's an enhancer of the efficacy of chemotherapy or radiation. There are plenty of studies showing that if you combine hypothermia with radiation or with chemotherapy, you just have much better results. And also we see here from the complementary aspect that if you perform, for example, a chemotherapy together with hypothermia, you can give the chemotherapy in more moderate doses, which means less toxicity, less side effects, better quality of life. So hypothermia means to heat up tissue, either as local hypothermia, for example, to heat up local tumors or local metastasis, or using whole body hypothermia, where you heat up the whole body and at the same time all tumors and metastasis in the body at the same time. These both are used to enhance the effects of chemotherapy or radiation. The other complementary treatments I talked about, these are treatments not really enhancing the effect of chemotherapy, even though some of them do, but the Idea here is more to help the body of the patient to remain strong, even so getting toxic treatments, and to help patients remain their quality of life, even so they get chemotherapy or radiation. So here this is a bit different approach. And also the studies about this treatment were finally designed not comparing the efficacy of chemotherapy. That's only if you do studies together with hypothermia. For other complementary treatments, the study protocols include quality of life sheets, for example, fatigue, other symptoms which patients may have, and they are observed and monitored and documented.
What is the best, in a way, complementary therapy that there is in regards to side effects in general?
You cannot say there's one complementary treatment or one method. This is a bunch of different treatments which have to be set up in the right order and in the right way. A very important role plays, for example, the treatment with high doses of vitamins and antioxidants. Vitamins, for example, vitamin C has shown in many studies that the patient's strength is better, that they have less fatigue, that also less frequently infections appear. Also, but other antioxidants like selenium are also very well researched. Selenium, for example, to reduce side effects of radiation. Glutathione is researched, which has also an effect to reduce the side effects of chemotherapy or radiation and also to strengthen the body. Also, the high doses of antioxidants help to detoxify the body, and they provide the immune system with the substances it needs to work with.
So our next question is, what effects have individual therapies on the body?
Now here we have to set up an individual program for every patient depending on his situation at the moment. So the treatment will be different if you start it before chemotherapy or radiation starts, or if the patient has had already radiation or chemotherapy. Also during chemotherapy or radiation, the same days, for example, you should not do some treatments. For example, high doses of IV vitamins or antioxidants should not or never be given on the same days as radiation or chemotherapy, because there's a theoretical risk that this may interfere with the efficacy of the chemotherapy and radiation. So you have to be very careful to do everything the right way.
So how long would you have to wait?
At least you have to wait 1 day in between, so that the chemotherapy substances are not as active metabolites anymore in the body. And the same is with radiation. Also here you should have to wait a while before you start these high dose treatments. And so everything has to be set up in the right way. Other immune stimulation treatments, for example with mistletoe extracts or thymus peptides, they should not be given if a patient suffers from leukemia or from lymphoma, because these are diseases of the immune system, and when you stimulate the immune system in a strong way, you may stimulate the malignant clone, and this can be dangerous. So here you have to see, for every disease, the experienced complementary doctor has to decide which treatments are necessary for the patient and which are best for the moment. Also, it depends if the patient is strong and fit, or if he has had or she has had many treatments before, maybe very fatigued, very tired from a bunch of chemotherapies before. Again, here the program would be different. In these cases, you may add L-carnitine to support the mitochondria, or to supply more energy. You may need parenteral nourishment because patients may be cachectic and have lost lots of weight, to help them to regain energy. So many treatments are possible, and they have to be set up in an individual way.
So, talking about your patients in the past, have you ever came across issues in regards to stress? Because often enough, patients have a lot of, as you were saying, a lot of different appointments going on for different kind of therapies.
You mean stress caused by treatments? Stress caused by too many treatments.
Exactly, by the amount of treatments.
Oh yes, I would say yes. For example, recently I had a patient, she was my record holder now. She came to me with 256 different pills to take every day as complementary treatments. So she had seen many doctors and naturopaths, and they all gave her some drugs and some supplements, and at the end she had 3 large double handful tablets to take, and she begged, please, which can I leave away because I have so much stomach ache. So this can be a type of stress. Also, if you run from one treatment to the other, let's say ozone treatment, oxygen, and then biomed, or whatever you may find in the internet, and you get there lots of information about useful and sometimes also not so useful treatments, you may indeed run into exhaustion, that you do too much. So also here you need to discuss the situation with a specialist for complementary medicine to decide which ones and which treatments are the most important ones, so that you don't run into such a stress. The body also needs time without white-coated people around.
So in regards to the patient that you were just talking about, how did it turn out then in the end? How many pills from the 256 did she actually have to leave out?
So at the end, and as we discussed that, we could finally solve the problem that she takes 8 pills a day, because most of the substances she took were not well researched, were just based on claims but never on studies. So we could let many of them away. Some of them were even dangerous, and we had to let them away, because if they cause more harm than benefit, it doesn't make any sense. And many of them just useless and just expensive. And you see, if you have to pay so many pills from different companies, it's a lot of money you have to invest every month.
But it's not only the fact that that they can be harmful in general, but also the side effects. If you combine them, could that not lead to more than just a little bit of stomach pain?
And that's a very, very important question which you tell, because here I have to point out again how important it is to make studies about benefit but also of side effects. And very often it is not researched well, the interactions of treatment. Look very simple, for example, the new tyrosine kinase inhibitors which are used for lung cancer. Simply adding these pills and drinking them with grapefruit juice can end up in disaster, because simple grapefruit juice may enhance the resorption of these pills in a way that the patients run into immediate and severe toxicity. So you see how important it is to read, to study also the effects and also possible side effects of also complementary treatments, of every treatment you take. And the more treatments you take, the more risks you have, of course. But you can say in general, comparing now, let's say, chemotherapy and vitamins, the side effects clearly are on the side of the chemotherapy. But I think it's important to know what you give, and that every treatment you give is supported by studies. That's our system, which we do here.
So with our last question, I would like to come back to hypothermia. Is hypothermia helpful to every kind of cancer in general, or does it only apply to certain cases?
In general, you can say that hypothermia is effective for every kind of cancer, in particular solid tumors like breast cancer, lung cancer, colon cancer, prostate cancer. And for all these cancers, there are studies showing that the efficacy of chemotherapy or radiation is enhanced. And for example, cervical cancer, the combination of radiation therapy and hypothermia is approved as the best possible treatment, for example, in Holland by the social health insurances, and also paid there in the social health insurances. In other countries, unfortunately not. They want to repeat all the studies, and it's a very difficult process to approve such a method, because there are not so much commercial interests behind. If a new drug comes up, there's a high commercial interest. You can sell this drug to every patient again and again, and this means a big profit. With one hypothermia machine you can treat thousands of patients, so it's not so much money to make with hypothermia, and so the interest of creating studies is less and not forced as much. Maybe this is one explanation that the studies are not so many, but all over the world we have to say there are hundreds of studies appearing every year, in also double-blinded, or let's say not double-blind but randomized studies, because you cannot double-blind really the hypothermia treatment. Randomized studies where you can see and compare patients treated with hypothermia and without hypothermia to see the differences. And most of these studies show positive results.
So because you were mentioning that it's so hard to make this hypothermia globally an existing case, do you think that due to hypothermia not being available globally, that this could impact the way how to go against cancer and how to progress?
I'm quite sure that this affects many patients if they live in countries where hypothermia is not available, or if it's just not available for the patients, even in Germany, because there are certain patients, and I think it's quite a few patients who really benefit from this treatment combination, and this is also shown in studies that the numbers of response are higher and survival times are higher. But we have to wait. We cannot really force that. Here we have to wait new studies to come up, approval starting in several countries. We have to see that now at the moment it seems to be a bit of a race also between the countries. So the hypothermia is increasing its importance very much in the Asian countries. So just in the last year, for example, in South Korea, 26 devices for local hypothermia were sold from the market-leading company Oncotherm. And this means much more machines were sold to South Korea than to any other country. And so it means it shows the strong interest in these countries in hyperthermia. And most of these devices were sold to university hospitals. And so we are now curious to see which studies they will bring from there in addition to the existing studies. So I think the hyperthermia is on a good way. And I hope that in the future most patients have the chance to get the hyperthermia.
Coming back to something that you have mentioned in the beginning of the episode in regards to local hypothermia and normal hypothermia and the differences that it does. Why would you go through local hypothermia if you could just take the full body hypothermia instead?
Local hypothermia is a much easier procedure and it's focused on a specific area. Whole body hypothermia is you need general anesthesia for the patient. It's a much more difficult procedure, also more expensive. And here you have to see, it depends on the patient. So if a patient has metastasis everywhere, then whole body hypothermia, a very clear decision, would be the better choice. If a patient has just a local tumor and maybe metastasis to regional lymph nodes, the local hypothermia would be the better choice because easier to do and also much cheaper. So here we have to decide, and it really depends on the patient's situation.
So unfortunately this is it for the first part of the episode, and we would like to come now to the viewers' questions. And however, we only have one question from the viewers today, so I'm asking here, please send us as many questions as you can because we are here to help you further. So coming to the question, it says here, why did my doctor not refer any complementary therapies to me?
That's also a good question, and I'm also asked by many patients why my colleagues never suggested any complementary treatments. I think this is first a question of knowledge. I'm also a teacher at the university hospital, professor in Sevilla and also in Gießen at the university. And if I talk with students there, they have no idea of complementary treatments. It's just not taught at the university. So the only way to learn complementary treatments is by learning them by yourself after your studies, which means you have to study that in your spare time, and in a full program of work. This sometimes is not easy, especially if it's not supported by your department. But this changes at the moment. So all the big conferences about cancer, they all have a chapter including complementary treatments, where the newest researches are published and discussed. And so the knowledge about complementary treatments is increasing. And I can also see it here now. Before, let's say 10 years ago, in the surrounding hospitals, complementary treatments were a no-go. Now the neighborhood hospitals, they offer infusions with selenium, they offer sports therapy, they offer yoga and other complementary treatments to help patients. So I think we are on the right path, but it may take time. And I think we also have to distinguish a bit between countries. Germany is, in general, more open for complementary treatments and naturopathic treatments. Germany is a country of homeopathy. It's a country of anthroposophic medicine. Traditionally, Germany was always a more open country for alternative and complementary treatments compared to other countries where they very strictly follow the textbook and don't look to the right and don't look to the left.
This is it for today, so thank you so much for your attention and your time today. Thank you.
Yes, you're welcome, Mr. Steininger. Bye-bye.
All in all, complementary treatments are not used in order to get rid of cancer cells themselves, but to actually assist the body on coping with the dreadful side effects of radiation and chemotherapy, as these can be immensely challenging. Unfortunately, these therapies are not acknowledged all around the world. However, more oncologists start to see the upsides of complementary options as talks and symposia are discussing the positives of hypothermia and ozone therapy, just as an example. If you have enjoyed this episode, then leave a like below and subscribe to our channel to never miss an episode. And if you would like to find out more about cancer, then follow us on social media. This was Cancer Now with your freelance journalist, Benedict Steininger.